So hopefully the recording has started. Very excited to talk to you today about promoting health and safety through policy, the Tulane University Alcohol Policy, a guide for faculty and staff. This has been a long-term project that we've been working on to bring a new and updated alcohol policy to the university, and I'm happy to share this with you. I do encourage you to use the chat function of the webinar and ask questions as we go along. I'll do my best to provide answers. Anything that I'm not able to answer live for you today, we will post on the website so that you can get those later. So thank you. So if you didn't know, we do have an updated alcohol policy and that is clearer and easier to understand. And really, this was a several-year project for us, but these are the new window clings, which you'll see popping up around campus, part of our marketing for the new alcohol policy. There will also be yard signs that I believe are being put up as we see, as we talk today. So very exciting that we'll be marketing this. And the focus for the new policy was really twofold. One is to create a safer environment for our students, and also to start educating our faculty, staff, and the greater Tulane community about the dangers of high-risk drinking in our undergraduates and how we might create a safer environment for them. So if you haven't, anything that we're talking about today, protocols or services that we reference, please go to alcohol.tulane.edu. It will be there, and if it's not there, I will be happy to make sure that it gets posted for you. So the Alcohol Taskforce was formed about 2 years ago, and really the purpose for that group was to reduce negative health and safety consequences to Tulane students related to alcohol and other drugs, and to increase college and community environmental factors that support healthy and safe norms. So we were really looking at several different aspects of how we might be able to intervene and create a safer community. Policies, procedures, and university response is one of our more active subcommittees. We've also looked at communication and partnership and prevention and education. And I'll talk a little bit about all of those today, but I'm going to really focus on the new policy and procedures or our protocols and how we got to the point with the current policy. We have used data to inform program and policy. We have several data sources that we talk about in regards to alcohol. We have My Student Body, which is an online course that students complete pre-matriculation, so we have several years of data there. We also complete the National College Health Assessment from the American College Health Association, and we've done that since 2008 and have looked at trends in alcohol use since that time. We also look at Healthy Campus 2020, which is a set of national goals or benchmarks for where we should try to get our campus in regards to a variety of health behaviors, including alcohol. We also have data from our Basics program, which is brief alcohol screening and intervention for college students. I'm going to share just a little bit of our NCHA data with you, and I think this really highlights why a change in policy was important for us and why we brought this forward at this time. If we look at high-risk use, and I'm going to primarily talk about in our undergraduate students, we do know that graduate and professional students use alcohol, but their use differs significantly. But if we look at high-risk use in our undergraduate students, and binge drinking specifically, that's 5 or more drinks in one sitting, we've seen a significant increase since 2010. In 2010, our students would say about 47% of them would have reported a binge drink episode in the previous 2 weeks. If we look at our fall 2014 data, we were up to 58%. This is unique to Tulane. What we know that in regards to our alcohol use nationally is that we've seen some leveling off. Now, there are some individual differences, but if we compare this data to peer institutions and the national averages, we do know that we're higher across the board in regards to alcohol use. So this really, for me as a public health professional, brought home why we needed to have changes in policy, why we needed to make change in the way we were treating this on campus. We also know that consequences for students are on the rise. And if we look at the top consequences among students who choose to drink, we are nationally, we are higher than the national average on almost every consequence data that we collect. I think 8 out of the 9 were significantly higher than the national average when we look at Tulane students compared. So doing something they later regretted, forgetting where or what they were doing, they may have had unprotected sex or physically injuring themselves. And again, as we approach alcohol as a public health concern, knowing that negative consequences are on the rise and that we're so much higher than our peers and the national average, it was concerning to me. And I think the group of people that worked on the policy would felt the same way, that we needed to intervene. And an environmental approach seemed to make the most sense at this time. We know that with the data that we have, there are several alcohol initiatives that are work here. So programming that encourages effective self-protective behaviors. We know that student-run alcohol-free late evening activities and alcohol-free spaces that are open late at night. So really providing an opportunity for students to be in a place where they don't have to drink. We consistently get data back that there is a pressure here, or a social pressure, specifically strong in our undergraduate students, where they feel like they need to engage in drinking, or they don't have a place where they can go and not drink. We also recognize that guidelines for parents, guardians, faculty, staff, and student leaders about how to talk to new and incoming students about alcohol was important, had been missing. As we have begun the change of looking at all of our health services over the last few years and talking about alcohol, tobacco, or sexual violence, whatever the topic might be, we know that parents, faculty, and staff should be our partners on these initiatives, and that we need to be engaging in different and new ways. And finally, I think the data really supported implementing and enforcing policies that prevent underage and high-risk drinking. I will say that we have of-age students who drink and engage in high-risk drinking. However, if we know that we can target those underage students before those behaviors become set in, we have a greater opportunity to intervene. And we can use policy to do that and have a much greater impact. So we get a lot more bang for our buck with that. So these are the types of initiatives that we've been looking at. I think it was interesting for me as we started working on the alcohol policy, which was about actually 3 years ago that started, that a lot of people were unaware of the policy, that we had a policy in place, that there were some measures there. But we know that an alcohol policy, or a strong alcohol and other drug policy on campus, will affect high-risk drinking because they influence the decisions students make about and consequences resulting from whether, when, how much, and under what circumstances they drink. So that we know that if we start to set standards and that there are consequences for behavior, or that there are consequences for good behavior, that the alcohol policy could change the high-risk drinking that we see. We know that policies, procedures, and discipline should reflect shared basic principles regarding responsibility and governance on campus, and to the extent possible reflect broad and dynamic involvement from all campus constituencies, especially students. The new policy that was passed had strong student support. We also worked very hard to engage our faculty and staff and any individual who might be somehow influenced from this. So TUPD, for example, has participated. We had graduate and professional students on the committee, which is exciting for us. We had an alcohol summit over this past summer and really had over 100 different campus partners, faculty, staff, and students come together and talk about this issue, and have been working diligently to address how we implement the policy, what protocols need to be in place to supplement this, and provide a framework for how we move forward with this. So when we talk about policy, I think there's a little bit of history that is important to understand. Again, about 3.5 years ago, we completed a biennial review, or started a biennial review, I should say, which is required as part of EDGAR Part 86, which is a Department of Education mandate that we review all alcohol and other drug programming on campus. When we started to do that review, we realized very quickly that the current alcohol policy at Tulane had been edited numerous times, and some of those edits were to make it easier for students to drink. Some of those edits facilitated having alcohol at events and removed some of the barriers or environmental protections that we really think should have been there. It was also a document that was about 17 pages. I've worked on many policies in my career, and I can tell you that I couldn't understand it. There were numerous protocols included in that policy, and so we really felt like what we had in place was not sufficient and wouldn't allow us to adequately address this issue. Fast forward, it took us almost a year to complete that EDGAR review and begin the process of really writing a new policy that would comprehensively approach this issue. I will say that the new policy as we go forward is not a perfect policy, but I do think it's a transition from a very dated model of an environmental approach or an alcohol policy on a campus. And I think we did build in the opportunity to do continuous updates and review so that we won't go so long that we won't know the last time that the policy was reviewed. So that's the history of this. If you go out, and I encourage you to do this and look at the Tulane website, you may find many, many old alcohol policies there. We are attempting to make sure that those are removed. We also know that sometimes departments post old policies. If you find those and you let us know, we will work with technology services to make sure that that gets taken down, because we really want to make sure that people are looking at the correct policy. Again, the policy officially is housed in the Tulane Student Handbook, which is done through Student Resources and Support Services, the Office of Student Conduct. It's also housed on alcohol.tulane.edu, which was created this past year by our Health Promotion Office, the WELL, to have a single landing page for all alcohol information. So, what should faculty and staff know about the new policy? Some significant changes, and these are all not new, but they may be things that I think people really were surprised about. We looked at alcohol use as, we wanted to approach this as a public health issue. We didn't want to be the party police. We weren't here to say that students drink, but we really wanted to come in at this and look at what is the high risk use and how can we monitor and control this. And I think that that was an important framework for us as we were talking to students and attempting to get students to really engage on this issue and be supportive of this initiative, because we really wanted them to understand the data and the issues that were going forward. We also recognized that faculty and staff were not mentioned consistently in the previous policy. And so we did address what does it mean to give administrative approval, that the policy does apply to faculty and staff if they're having events, and what does that look like? So those were some of the discussions that we had. We also definitely needed to recognize that graduate students, undergraduates, and employees were separate groups. The previous policy typically used the term student, and so graduate students were being held to the same standards as undergraduates. Undergraduates were being held to the same standards as graduate students, which created a lot of confusion in regards to protocols. If I'm registering an event for a graduate student, that should look different than undergraduates who are mostly underage. We also added a definition section, and I'll talk more about that. But I encourage you, if you haven't, to read the definitions and make sure that you're clear on those. Those were very important as we were working on the new policy to make sure that people understood the terms that were included there. Who can give administrative permission? What does it mean to have a university-sponsored or related event? We also significantly changed the requirement for third-party vendor. Almost all on-campus events, with a few exceptions, do require a third-party vendor. Most off-campus events like that as well. There are a few exceptions, and I will talk about those. But we felt strongly that to have a third-party vendor who was monitoring these events where students would be present created a safety net that if they're enforcing what the legal laws are, they would be monitoring for high-risk drinking, that they would be looking for underage drinking and starting to help us manage that more effectively. We did include enforcement and policy review sections so that that would be happening annually. The previous policy didn't talk about what possible repercussions could happen, and so we do have a section that references student code of conduct and that there are repercussions, and that is a requirement from the Department of Education in regards to Edgar. We also talked about open containers, which I think is something people don't realize, that we don't allow open containers on campus during most events, so we have dealt with that. And we removed all protocols from the policy. The previous policy was really full of protocols that might need to change based on we're using a different software program for event registration or a different office manages this. So we removed the protocols so that those could be updated as needed to be more responsive to student or faculty staff needs, whereas the policy is a more comprehensive document and provides a more global picture. So open containers. Just to make it clear, faculty, staff, and students of any age and their guests may not possess open containers of alcohol or consume alcohol-related beverages in public areas. And we gave examples of what type of areas we're talking about. Except at a university-sponsored or related event that received administrative permission that specifically provides that open containers will be permitted. So, again, you can't just show up on a Friday night and walk around with an open container of alcohol. We know that this is happening, and we know that this is also a situation that puts students at risk because we can't monitor what's there. So not having open containers on campus is a safety measure. So there are some opportunities where we do allow open containers. So Crawfest, for example, or tailgating, or outdoor events with designated boundaries. And again, Notice that we talk about administrative permission, and I'll talk about what that means in a few minutes. But we wanted to create opportunities where open containers would be acceptable and where it would be okay. But typically, no faculty, staff, or students should be walking around campus in an outdoor area with an open container. And that does differ from New Orleans law, where you can walk the city with an open container. We just don't allow that within the confines of campus. Definitions were our other, I think, big area of change. And the definition of administrative permission: provosts, deans, executive directors, and vice presidents have the authority and responsibility to govern the use of alcohol in areas they control, both indoors and out, and to approve or disapprove of plans for alcohol to be served at university-sponsored or related events. Administrative permission for the service of alcohol at university-sponsored or related events may only be granted if that university-sponsored or related event will comply with Tulane's alcohol and drug policy, and the event is designed to ensure that only legal age individuals will have access to alcohol at such events. This was an important piece, and we actually worked with the provost and a lot of the higher level administration at the university to define who should be able to give administrative permission. So this, again, shifts the ability to give permission to a higher level than was in the previous policy, that we are expecting deans of schools, executive directors, and vice presidents to really know what sort of events are going on campus, what type of alcohol might be present. Is it a safe event? Is underage drinking being monitored? And are they in compliance with the alcohol policy? And so we're looking at a higher level of recognition of what's going on and expecting some help and assistance from our senior level leaders on helping us manage alcohol on campus. University-sponsored or related events was a really big talked about item as we were defining how this policy should work. And so for the purposes of this policy, a university-sponsored or related event there's sort of 3 different criteria. So you can meet one or more of these. One is registered with the university. So is this an event that is university-sponsored in some way? Did they register it through the Office of Student Programs? 2, is it affiliated with a university department, unit, organization, or activities that relate to the education, research, and community service missions of the university, or to the goals or objectives of the department, unit, or organization? Or 3, that is hosted by a university-recognized student organization, university department, or unit. For alcohol to be served at a university-sponsored or related event, administrative approval must be obtained. So again, if the event in question meets one of those criteria, then you would need administrative approval to have alcohol at those events. And again, we're not looking to limit the ability for those things to happen. We just are asking that senior leadership be aware of what's going on in their schools or colleges, or in the events that are taking place and how that might work. So this was important for us to have a definition for a university-sponsored or related event. I was recently asked the question, or I received an email that said that I was basically saying that you couldn't have an event at your house as a faculty member and have students. I'm not saying that at all, and I don't think that was the purpose of the policy. If you wanted to have an event at your home as a faculty member, and maybe you're inviting a graduate student to your house, that would not be a university-sponsored or related event. A university or sponsored related event might be if the dean decided to have a dean's hour on campus and the entire undergraduate program or graduate program was invited. That's when we would be looking at this as a university-sponsored or related event. A faculty member having, say, a Seder at their home and wanting to invite some students for that event, that's more of a private event. We didn't see that as a university-sponsored or related event, and it would be okay. So again, understanding the administrative permission and the university-sponsored or related events is important, and I'm happy to meet individually to discuss any specifics on that. We're also working very hard to make sure that the protocols that we have in place through student programs for registration will match this. And that's been key as well. So what the policy means for faculty and staff, what this means is that faculty, staff, and students have to comply. By following the policy, you're helping keep our campus safe. Again, our goal with this is about health and safety. We are looking to reduce high-risk drinking. We are looking to promote a culture of responsible drinking. And we know that if we do those things, that we're going to reduce the negative consequences for our students. Protocols, procedures, and programs that are in place, most of the protocols are managed through Office of Student Programs, through our Campus Life division in the Division of Student Affairs. We also have some procedures that are and protocols that are managed through Student Resources and Support Services, specifically the Office of Student Conduct. We know faculty and staff should know that alcohol may be served at events at which the attendees will be administrators, faculty, and or staff without a third-party vendor with administrative permission. So if it's a faculty meeting and they want to have alcohol there, the dean has the ability, or the vice president or the executive director, they can give administrative permission and have that. So the event that comes to mind would be a faculty meeting, or maybe an event at a faculty member's house, where it's all faculty and staff, and those people we're assuming would be of age. You cannot use a third-party vendor for that. So they want to have the alcohol themselves. Alcohol may be served at events at which the attendees will be of age graduate students without a third-party vendor with administrative permission. We have several very active graduate and professional student organizations. So those groups, because the majority are of age, we believe can have events without a third-party vendor should they have administrative permission. So GAPSA, for example, as the graduate and professional student government group, could have an event where it's truly GAPSA members present, graduate students, and not use a third-party vendor if their dean gives them permission. So again, they could have alcohol provided at an event, holding that it meets all the other requirements, or a demarcated area. They have sober event monitors and things like that. In all situations where alcohol is being provided, it is expected that no person under the age of 21 will be served. And the second statement here is Louisiana law. This was not our rule, but this is what Louisiana says. It is unlawful for any person under 21 to purchase or publicly possess any alcoholic beverages. Public possession means possession of any alcoholic beverage on any street or highway, or in any public place, or any places open to the public, including a club which is de facto open to the public. So that's the law. What we're saying is that it's illegal to serve under age 21. And so in any situation where undergraduates will be together with graduate students, the rules for undergraduate students apply. And that was new in this policy, that we didn't think. Oftentimes students have graduate and professional students, and undergraduates will want to co-host an event. And then it was, well, what set of rules apply to us, or what protocol applies to us? It was important that undergraduate rules apply in those events, because undergraduates are present and the majority of our undergraduate students are not of age. So again, keeping with Louisiana law, that was the purpose of this. And that was a really important piece for our graduate students to have that clarity. The event registration protocol for students: all undergraduate students or student organizations planning an event where alcohol will be present must register the event with the Office of Student Programs and the supervising university department. Again, thinking about if this is an official Tulane event, who will be giving the administrative approval for that. Oftentimes, administrative approval comes from in the department from the organization's advisor, but that organization's advisor should make sure that the dean knows that they're giving that permission, because that's who ultimately is responsible for these events. Each semester, the Office of Student Programs will review the alcohol policy and event registration protocol prior to hosting any events with alcohol with each of those student organizations. And that's new this year, and I would like to give a shout out to our Office of Student Programs, because I think they've done a great job of really trying to get the protocols fleshed out, to do more work with the student organizations to make sure they really understand what the rules are and how to do that. And so thank you, Greg Filing, and the Office of Student Programs, for really taking the lead on that with us this year. And I think for our graduate students, we have a different set of protocols for them. And I think that they gave a lot of good feedback so that they had protocols they felt like met their needs. At undergraduate events, with the exception of BYOB events at recognized fraternity houses, alcohol must be served by third-party vendors utilizing a cash bar. Undergraduate organizational funds may not be used to purchase alcohol. And again, we have a couple of carve-outs for Greek life, which are specific, but in general, at undergraduate events, regardless of where they are, we're requiring them to use a third-party vendor. And again, that's to reduce the risk to the students. We didn't want them bartending themselves, and really using a third-party vendor to help do that environmental management piece. When students go to register their event with the university, all student organizations planning an event where alcohol will be present must register their event with the Office of Student Programs through OrgSync. OrgSync is an electronic system which allows all of these approvals and questions and protocols to be managed electronically. That's new. It was started last year, and it's really working well. But we do ask that at least 3 weeks prior to the event. So if you're supervising a student organization and they would like to register their event today, and it's this weekend, that's not going to happen. They really need 3 weeks, and that gives us time to make sure that the event is well planned, that proper security is there, that all of the protocols that are needed are in place. And that's important. We also have monitoring flow of alcohol. So part of the protocol is at undergraduate events, what does it look like for alcohol use to occur? With the exception of BYO events at recognized fraternity houses, alcohol must be served by a third-party vendor utilizing a cash bar. Undergraduate organizational funds may not be used. We have had in the past student organizations wanting to serve themselves. So, oh, well, one of our members will be the bartender. We really don't want that happening. The one exclusion there are at our fraternity houses, and I'll talk a little bit more about that. Graduate professional students have a little more openness with that. Again, because we're looking at of-age alcohol use there. Students event utilizing an open bar, a drink management mechanism will be put in place to keep consumption to 1 drink per hour per person. The practice of self-serve is prohibited. All service of alcohol must be conducted by a third-party vendor. We do have some leeway with that. With the graduate students, it's slightly different. We also require that our TIPS trained sober event monitors be present. So 1 TIPS or sober event monitor for every 50 people in attendance. And if you're a faculty or staff member that supervises a student organization, I would encourage you to attend TIPS training so that you're familiar with that. TIPS is training for intervention procedures. It's the university, this is a university-specific or college-specific course that's offered by the Division of Student Affairs that students must take to be certified as a sober event monitor. All sober event monitors must be 21. And the individuals who go through this training are trained on safe drinking practices, how to recognize and intervene. They also should be reporting back if there are issues or making the call to TUPD should someone look like they maybe are experiencing alcohol poisoning. So they have some responsibility, and we're really talking about how do we beef this program up over the next year as well. All students organized or student-related events with alcohol have to have this. I would encourage you, again, if you're a student organization supervisor and have never been to this training, take it. You can register for it online through the alcohol.tulane.edu website. TIPS does not qualify any student or faculty or staff to serve drinks or check state-issued IDs at a Tulane event. So this isn't training on how to be a bartender. This is really how to manage the environment of a party where alcohol will be present. The student event protocol, again, we have a variety of things to talk about in regards to managing the guests and security. And again, these are the types of things that the students would be asked to provide through WorkSync or through the Office of Student Programs. A guest list must be submitted to the supervising university department no later than 5 p.m. on the day of the event. Open parties, meaning those with unrestricted access by non-members or guests of the organization without specific invitation where alcohol is present, are prohibited. So we're not allowing open events where just anyone can walk in and get alcohol. We're really saying that you need to have a guest list if alcohol is being provided, some sort of a means to check that the students going into that or part of the event is there. You also have to have a security plan. We will be working with TUPD to make sure that if the officers are providing security, that they're watching for improper alcohol use. So that's a process for us. And we know that that's been difficult in the past. And what are the expectations? We also want to make sure that there are control measures at every designated entrance and exit of the area. So we probably would not approve an event in an area where you couldn't really control who was coming and going, because it defeats the purpose of a guest list. If the space means that pretty much anyone could walk up and get alcohol there, is this really a safe area? What does that look like? We also require that free and sufficient food must be provided, as well as unlimited free water or non-alcoholic drinks. So you want to make sure if you are doing an event on campus or your student organization is providing alcohol, that they also have water provided. So if you're using, for example, on-campus catering, you want to make sure that you've ordered the water to be there with it. Again, those are some conversations we'll be having with Olive Blue, just to remind them that if a student organization is providing alcohol at an event in some way, whether graduate or undergraduate, we would want them to have water there as well. So we're hoping to make them give them a reminder on that. Greek events with alcohol are handled slightly differently. One of the carve-outs in our current policy is that fraternities may hold bring your own beverage events at recognized fraternity houses, provided they register the events via the Office of Fraternity and Sorority Programs WorkSync site. So Greek life currently is handled a little bit differently than typical student program events or the student organization or graduate students. And there's some reasons for that are good. They have specific guidelines from their national offices that must be followed. And also to point out something I didn't know is that sororities actually are not allowed to host events at their house with alcohol, only fraternities. So a lot of times I have heard, oh, sorority X was hosting an event with alcohol. They actually aren't allowed to host events like that. So if you hear that a sorority hosted an event with alcohol, you should report that to the Office of Fraternity and Sorority Programs so that they could address that issue, because that shouldn't be happening. Fraternities, on the other hand, can. They do have a very strict BYOB policy, which, if followed, is designed to keep safe and responsible drinking in place. Fraternity organizations and their officers are subject to corrective action through the Office of Student Conduct if there are violations of the underage drinking law or university policies and regulations. So there are repercussions if they do not follow the event. So if we find out that they broke the protocols or if they're not following the rules, there are some significant repercussions for them, both from Tulane and their national offices. We have also important to point out is what we're calling the Responsible Action Protocol, or RAP, which is more commonly known on campus as Medical Amnesty. We're in the process of a name change with this protocol. But all Tulane students are expected to proactively alert appropriate officials in the event of any health or safety emergency, specifically including those involving the abuse of alcohol or drugs, even if violations of the student code of conduct may have occurred. The RAP protocol, or Medical Amnesty, was put in place to encourage students to call for help if a student was experiencing negative consequences of drinking. So if a student is struggling with possibly alcohol poisoning, if they find someone passed out, they can use this protocol to make the call to TUPD, and they won't go through the conduct process. There may be some follow-up that will occur, but it's different than going through the conduct process. So we really want students to know that, we understand that situations may occur and you may find someone who has drank too much or you think maybe has used drugs. We didn't want the conduct process to be a barrier for them engaging with TUPD and calling for help. So this protocol is in place. The updated protocol is now posted online, so I'd encourage you to take a look at it. And again, we're really moving from the idea that it's medical amnesty to responsible action, which I think is a better description that we're expecting students to take responsible action for their friends and to help take care of their community. So when we talk about preventing high-risk use, how to keep our campus community safe, I want to highlight a few of our activities on campus besides the policy that we have. We know that educational components are designed for both individual students and groups are integral to a comprehensive approach to address high risk from drinking. We have a variety of educational and interventions programs on campus. All students for over a decade have had to complete online alcohol education prior to arrival on campus. So we have had that in place for a very long time. What we know from that program, though, is that it's not real effective in changing the behaviors once they get here. So the policy will hopefully do that. If they get here and have had an education program that teaches them about alcohol, but then they arrive on campus and we're not necessarily demonstrating that we practice what we've taught you before you get here, then it's very hard to enforce the rules. We would also say that Basics is another intervention that we have that I think is very important, brief alcohol screening and intervention for college students. Basics was implemented in 2010 and is housed at the Well, and really is a state-of-the-art alcohol intervention. This is sort of the gold standard that you would want to see on a college campus. It's a motivational interviewing-based intervention where a student will meet with a health educator for 2 individual sessions, have the opportunity to address and talk about their alcohol use, and really, help them explore, are they putting themselves at risk? How could they alter their behavior or not? It isn't treatment. It isn't a stop drinking preach message. It is really about helping them sort of find their way and a way to be safe. I would do a plug for Basics is that the majority of students that go to Basics are coming from Office of Student Conduct or maybe had an alcohol transport through Medical Amnesty or the RAP protocol. Basics, as a faculty or staff member, any of you could send a student to Basics because you're concerned about their alcohol or drug use. So we are always excited to see a student before they've had a really negative consequence or had to go through a conduct process. So that's important. We also know that alcohol education for college students typically includes providing accurate information about the effects of alcohol, as well as addressing attitudes and behaviors related to use. We have a variety of educational programs where our health education staff will go out and talk about this issue for fraternities and sororities, student organizations. We also have a peer education program housed at the Well, and I think we have about over 50 peer educators right now who will go out and do education in the residence halls. So it can be provided on a floor, it can be done for an organization that you advise, whatever you need. And you can request those programs from the main health service website. So these interventions complement policies and environmental approaches. So I don't believe that the policy is enough, but I do think it's an important part of this as we go forward. And so familiarizing yourself with that. There are a variety of interventions that we aren't able to use right now, and I think the one I'm asked most often about is social norming campaigns, which really looks at typical student use versus actual behavior. Our data really doesn't support that as an intervention right now because our use and our perceived use are so close to each other. So if you have ideas about interventions or things that you've seen on other campuses that were effective, let us know. We'd be happy to consider those. These are the resources for alcohol misuse or prevention resources on campus. Again, I've talked about our prevention and education at depth, My Student Body, and peer education. We do have a My Student Body course that students can take once they're here, and that can be assigned through student conduct. Again, if you have a student that you think needs more alcohol education, we're happy to work with you on that. We've talked about basics, which is really about one-on-one conversations and goal settings. We also have CAPS, which is counseling and psychological services, which will provide individual and group counseling. So if a student that you're working with or that we know maybe needs to talk to a therapist because they're really struggling with some sort of a mental health issue or a mental or substance abuse issue, you could refer them to CAPS, who would do an assessment with them and make sure they get linked either internally to the proper type of staff or would help them find a provider in the community. We also have case management and victim support services, which is, I think, also a very important resource. Anytime you see it, if you're concerned about a student and you're not sure what to do, tulane.edu/concerns would allow you to submit a report about a student. You can do that anonymously or not, and make sure that someone follows up with them. Now, if you refer a student to CAPS, we can't tell you what we've done, neither can case management. But that concern report allows you to make sure that it's getting elevated. So it's not just on the student. Someone from that office, if you submit a concern report, will follow up with that student. So that is really a great way to engage students who you're concerned about because of alcohol use. So as a faculty or staff member, if you see a student in class who just looks like they're maybe not doing well, maybe if it's in the morning and they smell of alcohol, that's a great place to put a concern report in and maybe get that student some help before they get in trouble. We also have AA groups on campus, Alcoholics Anonymous, and those meetings are available. Again, if you know a student who might be looking for that or is in recovery, you could refer them to CAPS or case management, and they would be happy to provide that information to the students. Online information nationally, if you're wanting to look at the National Institute on Alcohol Abuse and Alcoholism, some great resources there. The Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery is also a great resource. That actually disappeared for several years and has just been relaunched in the last year, but again, has a lot of great resources and information about college alcohol use. So I really think that's a great resource. I want to thank you so much for your support in these endeavors. Our alcohol task force is, like I said, about 100 strong, and if any of you are interested in being part of that, it would be great. The committees have worked very hard and are being very responsive to responding to protocol issues. How do we manage large events? How do we deal with open areas? How do we engage our campus safety? So I really want to call out the folks that worked on that task force and for everyone that provided input or feedback on how this policy might impact our students. That has been extremely helpful. So now I'd be happy to answer any questions that have come across, if anyone has any. So I don't see any questions, so I don't know if I was so thorough that there were none or if there are no questions. I'm going to give it just a couple more minutes to see if anyone wants to type one in. If you're out there and listening and just want to say that you can hear us, and that would be great to know to make sure that we're not missing questions. So one of the questions is, can I address security at on-campus events? That's a good question, and actually we've had some discussions about this week as we've been working through protocols for the first few times. Security at on-campus events should be coordinated through TUPD. And again, that is part of the protocol that when you register an event, who to contact at TUPD and how that gets set up. So we're actually going to be meeting with TUPD to talk to them about what that security should look like and how it should be handled. But TUPD does have a protocol. They are aware of the issue and the resources that are available. So we'll be looking at that to make sure that it happens. I would recommend, and there is actually a security firm that will provide at late night events and other things where TUPD can't be present, but that is coordinated through TUPD as well. So we'll post a full response to that question on our website as we update the protocol and work with TUPD. We're really looking to find if we can have one contact person at TUPD for these types of events to make sure that it's always handled consistently and that the officers who are on those know how to engage at the event appropriately. Good. Another question is, can we address faculty staff events that are being held at a faculty or staff member's home that are paid for with university events? Good question. So I think there's two rules there. I think if it's a faculty and staff event paid for university funds held at a faculty member's home without students, again, administrative approval would be required. There isn't an event registration for that. So again, say the dean, for example, wanted to host the faculty at their home, they should be able to do that with administrative approval and use departmental funds for that. If this was an event that was an official departmental event that included alcohol and included students, you would want to register that event to make sure that all the protocols are met, and then talking that through with the dean to make sure that that administrative approval is understood, talking with student programs to make sure that the proper pieces are in place. And again, for undergraduate students, it's a little more complicated because we have protocols in place that prevent underage drinking or high-risk drinking in that group. For graduate students, they are allowed, it's a little bit different. So again, going through the Office of Student Programs or with those types of events to see what sort of registration is needed would be key. Again, if students are not present, the policy doesn't necessarily apply beyond making sure that the administrative approval has been granted. Sure. So question, why sororities cannot host events with alcohol, but fraternities can? It's a really good question. That came from their national office. That's a national organization. All the sororities as a group decided that events with alcohol cannot be hosted in sorority houses. So that is a national rule and isn't allowed, whereas the fraternity groups have not adopted that stance yet. I can tell you that I think it would be great if nationally fraternities did do that, because I think it changes the dynamic of what they can do. So there. And I would say with our fraternity houses, just a point, the reason we do allow BYOB there, different than we did for any other student group, is really has to do with the fact that we don't own those houses, and we wanted to make sure that we were providing a safe environment for them to drink. So really giving them an opportunity to environmentally manage those parties well. And again, nationally, they have a set of rules that say you can have these types of events, and we're trying to be in as much alignment with them as we can. Sororities have taken a very different stance nationally. And I know that because Liz Schaefer gave us quite a bit of feedback on this program, and she's the director of fraternity and sorority programs. Great question on, are there certain student constituencies that are driving the binge drinking rate higher, and are there any specific resources going toward those groups? What I can say right now is that as we've looked at subgroups of students on campus, I can't say that I have one group that is a higher than others. Do we have some differences? Yes. But if we look globally at them, we haven't been able to say that Greek students are necessarily engaging in high-risk drinking more than our non-Greek students, or that student athletes are doing that. So interestingly enough, alcohol seems to be an equal opportunity used equally among our student groups here. I can't find any data yet to support that. I do think as we do more education and promotion around this issue, that may become more apparent in our data. We actually, 2 years ago, contracted with the Social Norms Institute to take a more in-depth look at our alcohol data, and comparing our data to the registrar's data on percentage students that were Greek, non-Greek, looking at minority or LGBTQAI status. And what we found is that there were not significant differences among a lot of the subgroups. So at this time, I don't see that happening. We just see alcohol use pretty broadly in our groups. All right, well, that seems to be the last question that I have that I can answer. I appreciate your time. I appreciate your energy. If you have any other questions, feel free to email me, mtims@tulane.edu. I'm always happy to answer questions. If you think it would be helpful to meet, I am happy to sit and go through this or discuss this with you. Again, if you are supervising a student organization, reaching out to the Office of Student Programs now to really make sure you understand their protocols and OrgSync and how that works would be great. There's a lot of good resources and information at alcohol.tulane.edu. If you'd like a sign for your office, we'd be happy to get that to you as well. But again, I appreciate your support. I thank you for trying to keep our students safe, and I hope you have a great day.